The global average temperature continues to rise, and with it, the human toll of extreme heat grows larger every year. In the United States, heat waves are now considered the deadliest weather-related natural disaster. However, heat-related deaths are often misclassified as heart attacks, kidney failure, or other diseases, leading experts to believe these deaths are grossly undercounted. Earlier this year, the Federation of American Scientists urged the Centers for Disease Control and Prevention, CDC, to upgrade and expand its health tracking systems. This would help more accurately reflect the true impact of heat waves on human health, develop guidelines for states reporting on heat-related deaths, and integrate environmental conditions with electronic health records. Understanding the number of heat-related deaths annually would raise public awareness and help save lives. Christy Eby, an epidemiologist at the University of Washington, has studied the impact of climate change on human health for over 30 years. She believes accurate data on heat-related deaths would ensure investments in heat resilience match the magnitude of the problem. Those deaths are preventable, Eby noted. People don't need to die in the heat. The CDC currently estimates about 1-200 Americans die annually from heat, but this is likely a tenfold undercount. An estimate from several years ago suggested that there are actually 10,000 to 12,000 heat-related deaths in the US, and this number is likely higher. Today, heat-related deaths are often misclassified on death certificates, which typically list the immediate cause, such as a heart attack, without noting heat as a contributing factor. This makes it challenging to determine the true impact of heat at an individual level. However, population-level analyses comparing death rates during heat waves to normal periods can provide a more accurate count of excess deaths. The CDC is considering adopting a standard methodology to measure heat deaths, which would help raise awareness and ensure adequate investment in addressing the issue. While precise data is desirable, investigating all deaths during a heat wave would require significant resources and time, potentially diverting attention from other health priorities. Studies indicate that excess deaths due to heat waves are increasing with climate change in some areas, although adaptation measures such as early warning systems and cooling shelters can mitigate these effects. A significant modeling study found that, on average, 37% of heat-related summer mortality over the last several decades was due to climate change across 43 countries. Eby emphasizes the importance of recognizing that heat deaths are preventable and that humans have the capacity to adapt to extreme conditions. Developing heat action plans with early warning and response systems, as well as long-term urban planning, can help communities better withstand heat events. These plans should include measures such as cooling shelters, outreach to vulnerable populations, and urban greening initiatives. Despite the challenges, Eby remains optimistic. She believes that societal changes and advancements, along with the commitment of younger generations, will lead to more solutions for addressing climate change and its impacts on human health.